COVID-19 public briefing. I'm Brian Beam, Calcasieu Parish Administrator for the police jury. We appreciate those viewing today. Before we get started, we know, of course, COVID-19 has been with us now for 3 months or so, but other things go on, and I mention that because we've had some really severe weather today, especially in northern parts of Calcasieu Parish. So a lot of rain, flooding, and so we want to remind people to be safe. And hurricane season is around the corner, and everybody knows that, but these things have to go on, and we have to deal with them too. But today we will talk about the COVID-19 and status of things. Of course, the main change since we last had a public briefing was the governor's latest executive orders that is referred to as phase 1 of the reopening of the state, and we'll touch on some of those. I want to start today, as we usually do, with our Emergency Preparedness Director, Dick Grimion, and he's going to update us on the mobile testing sites, and there's a lot of good news on that front.
Thank you, Brian. As mentioned last week, we started a mobile test site. It's called a community program. We're getting around to the different cities, and as of right now, we did Lake Charles twice last week and Sulphur one day, and then this week we've done Vinton, DeQuincy, Ioway, and today Westlake. Tomorrow we'll be in Moss Bluff. We have used our 100 test allocation each day, so at this point we've tested 718 people. Unfortunately, at each of the sites we were at, we had more people who were needed testing, so we'll be making a second round. We'll be announcing that schedule tomorrow morning. But in general, it's been very, very good, and I'll let Dr. Kavanaugh talk about some of the results that we've gotten so far. The only other thing I wanted to mention is, as Brian mentioned, hurricane season is coming up. There's a little feature out by Florida right now that's may develop into a tropical system, but right now it will only be going out to the east coast, so hopefully it won't impact the United States anywhere. But we'll keep you posted on that if something changes. Anyone have any questions? Teresa?
Is there any testing in the works for children, especially now that they have this new syndrome they've been talking about, the inflammatory syndrome?
Yeah, you'll have to ask Dr. Kavanaugh about that. The question was, is there any testing being done specifically for children? I don't know. Dr. Kavanaugh probably could comment on that.
She's next.
Okay. Dr. Kavanaugh's next.
Sure, and good afternoon, everybody. I'll go ahead and answer that question off the bat. And the answer to that question is that there should already be some element of pediatric testing within our community. Many of the private pediatricians' offices, emergency rooms, and urgent cares can test pediatrics. So one of the reasons that the mobile testing site is not able to test pediatric patients is because the method that we're using to do that collection is a self-collection, meaning the person who's being tested actually has to insert that swab into their nose themselves. And we know that for pediatrics, that's not going to be a great way to get accurate results. And so I would encourage any concerned parents or children who feel like there needs to be testing to contact their doctor or their pediatrician's office to find out what testing options are available to them. But that should be available within our community. I've heard that several offices are able to do that testing with a pretty decent turnaround time. So the access to testing definitely continues to improve. In terms of my report today, I will say that although when you look at the LDH website you see numbers that appear to be increasing, I want to reassure people that those increases, a large majority of those new cases are not really new cases. They are cases that have been tested and their lab that was not previously reporting to the state electronically that is now reporting electronically. And so there was kind of this data dump that's been happening over the past couple of days that brings a whole bunch of new tests into the system. And so that's why we're starting to kind of see that. And we expect that more of that is going to happen as we bring more small labs that previously didn't have electronic capacity to report online to that system. So the number of true new cases that have been detected within the past couple of days still remains very, very small. So that's good news. Our hospitalizations continue to be stable or go down a little bit. COVID-like illness within our clinics and our emergency rooms continues to go down and is at very low levels right now. So I feel like in general, the amount of COVID in our community is still pretty small, and I think we're in a good place in Southwest Louisiana as we start to move into phase one. One other point I'd like to make about the mobile testing sites is that the test that is being done at those sites is a PCR test, which means it tells us if those people going through those sites have COVID right now. It is not an antibody test that tells people if they might have had COVID in the past and they've now had immune response to COVID. So if you had an illness back in, say, February or March, early March, and you're wondering, was that illness COVID, the testing sites, the mobile drive-through testing sites are not the place to drive through and find out that answer, because the drive-through testing sites are going to tell us if those people who are being tested have active COVID that could be spread to somebody else right now. The other thing about the mobile testing site is so far we've had many negatives come out of that site. So it appears that the amount of COVID in the community is still very small, and it makes me feel better about the fact that we're probably not missing that many people who are asymptomatic out there. So that's good news for this community as well. In addition to the mobile testing sites, we're of course really starting to focus efforts on testing within congregate settings, such as nursing homes, assisted living facilities, and homeless shelters and other places that, group homes even, that may have lots of people living together that could be of high risk. So you'll definitely see an increased focus on testing within those populations going forward. Those often also include medically vulnerable people, so they're definitely high risk. I'd also like to reassure people that it is safe to seek care for emergency conditions at hospitals, but also starting to seek those preventative healthcare services within the community. Because there are some medical conditions that you can't put off for a prolonged period of time, or else they become a big deal. When if you take care of them on the front end, they're easy to manage. And so I would say that we're still encouraging telehealth for routine things that fits the need for, but not every visit can really be accomplished effectively in a telehealth visit. And so reach back out to your doctors in the offices that you normally seek care, because many of them are now starting to see patients that need to be seen within the clinic back. And I don't want people to be afraid to seek care that they need, because then that causes a whole nother level of problems within the community. Lots of people are having the question of what does the new normal really need to look like? And I think we're all kind of answering that question as we move into this phase one. I do think it's definitely going to include some of the same things that you've been hearing. I mean, there's still going to be an emphasis on social distancing and on hand washing and on making smart choices. You definitely don't want to be the first one to run out into a crowd of many people, because there definitely could be people in that crowd that are asymptomatic and can spread it. I actually just saw an article this week of a choir practice in Washington that one asymptomatic individual at that practice spread the virus to numerous other people. And so we still have to be very cautious, but I think that as we move forward, that there are some things that we can resume doing as lined out in phase one. And so I encourage people to get outside, to spend time with their family, to turn off the news, because the 24/7 news cycle is not good for any of our mental health, including mine. So, just take it one day at a time. We got to keep watching the numbers. We have to be very cautious as we move forward. But I'm optimistic that we'll get through this and that we'll manage well in phase one, as long as we all do the things that we're supposed to do and we don't do things that are risky. So continue on with that. And still in phase one, we have to remember that people who are vulnerable, who are high risk, who say are of advanced age or who have chronic conditions, they are still at higher risk than young, healthy people. And so those people are still safer at home than out and about. And so we encourage them to take extra precautions, especially during this phase 1 time. I'd also like to make just 1 or 2 quick points about contact tracing, because you probably heard a lot about that, both on the national news, on the local news. And I just want to reassure people that contact tracing is something that we have done for a very long time. We do it for a large range of infectious diseases, including, of course, like you've heard about STDs, but also things like tuberculosis, measles. And so any contagious disease, this is a time-proven strategy to reduce unintended infections that happen when people don't know that they're exposed to one of these diseases and could expose other people. And so it is completely confidential. It's not intended to be punitive in any way. It's really intended to identify threats within the community in terms of people who could spread it to others, and also potentially settings that may be transmitting the disease without realizing it. I know that if I was out in the community and was exposed to something that could threaten my family and my children, I would sure want to know about it. And so please, as we start to roll out that, please be cooperative and know that this is the safest way for our community to proceed. So that's all I have for today, and I'll take questions.
With regard to contact tracing, I mean, are you asking, or should people try to, I don't know, keep a journal or mark on their calendar where they've been until hopefully one day this is behind us?
I mean, I think if people want to do that, that's fine, and certainly would be helpful in remembering, but I don't think it's a formal recommendation for people to do that. Our contact tracers that work with other infectious diseases here in the office are very skilled individuals at getting the information that they need and knowing who from those exposures are at risk. I also want people to know that if you identify people that you've been in contact with and then we contact them to let them know they're at risk, that doesn't mean that they're going to know that you were the one who exposed them. There's full confidentiality in that. And so it should be a process that is well ironed out because we do it already for many other infectious diseases.
Concerning the pediatric inflammatory syndrome that's linked to COVID, have there been any cases here locally? And what would you advise parents as far as being alert to the symptoms and whether there is local medical treatment available here?
Right, so we're learning a lot about this disease. It was really just started to be reported across the country within the last week or two. So we're definitely still learning a lot. It does seem to have characteristics that are similar to some other pediatric syndromes, like Kawasaki disease that we've known about, but there are differences, it sounds like. Main symptoms of this syndrome are going to be fever and red eyes and rash, but many of these kids become very ill, and some actually require hospitalization. Our pediatric workforce is, I'm pretty sure, well aware of the news reports. We are collecting reports at the state level. Of course, once we get a case that might be a suspect, then there are other things that have to happen. Those individuals have to have other tests to rule out some other more common cause, and records have to be reviewed to make sure that it fits the clinical picture of what's being reported elsewhere. And so it's sort of a process. It's not like a yes or no that you either have it or you don't. Sometimes it takes a little further investigation to determine if it's truly a case of this. But that information is being collected and vetted and reported like we would do with any other reportable condition. And we have gotten some suspects. So we're kind of still in the investigating phase of if that truly is a suspect or not.
Do you mean you've gotten some suspects here?
Yeah, we've gotten reports that that there are children, or at least one that I'm aware of, that may display symptoms that could be consistent with this, but we don't know if there's some other more common cause yet. So we're still receiving information. And I expect that that's going to happen. I mean, providers in the community are encouraged to report anything that could even possibly be something like this, because we want to make sure that we stay on top of it. So I don't want you to take the impression that we have a case, because that's not proven yet. But we are receiving calls of from local doctors who say, hey, maybe we might have something here, and so we want to investigate those.
Okay.
So don't take that as a confirmed case, because that's not true.
Okay, thank you. There's breaking news today that a virologist, Dr. Joseph Fair, who has been on the national news, I think he's a consultant for NBC, was hospitalized for COVID, and he thinks he got it from a crowded flight. He thinks he got it through his eyes. And I just wanted to bounce that off you. I mean, should we start wearing goggles through his eyes?
I'm sorry, but I'm getting a whole lot of feedback, and I'm having some difficulty hearing the question. Is someone able to repeat the question for me?
There is a virologist named Dr. Joseph Fair who is hospitalized for COVID, and he thinks he got it through his eyes when he was on a flight. He's nationally known. He's been on NBC quite a bit lately. And I just wanted to know if you had any thoughts on that and whether we need to start wearing goggles or something.
I don't think it's a recommendation for the general public to wear goggles, but we do know that the virus can be transmitted via droplets. So yeah, if someone coughs and a particle from their mouth lands in any of your mucous membranes, including your eyes, that could maybe potentially transmit the virus. It's why many of the healthcare workers that are working on the front line with COVID are wearing eye protection and shields, and we do that for many other infectious diseases as well. So I think that those people who are working directly with COVID patients already are doing that, but there's not a recommendation to do that in the general public, because we should be socially distancing already. So hopefully we're not close enough to other people for that to be a problem.
And there have been some articles suggesting that COVID can be transported on smoke, as in cigarette smoke and possibly vapor from vaping. And so the question is that true scientifically? And this is probably not your department, but the person wanted to know if they were going to allow smoking when the casinos open.
Yeah, I can't speak to the casinos. I have not seen the studies that you're referring to, but I'd be happy to comment on them if you could get them to me. I haven't heard anything about it being transmitted on smoke particles in particular, but we do know that smoking, of course, can potentially damage the lungs, and so smokers are at higher risk of having an adverse outcome from COVID.
And just one more question. Can COVID survive in water in a chlorinated swimming pool? And if so, what threat would it pose?
So chlorine, bleach, essentially bleach, should be an effective way to kill COVID. So as long as that pool is properly chlorinated and not contaminated, then I think that should be okay. Although many swimming pools, of course, we have to monitor the chemistry pretty regularly, because it's relatively easy for them to get out of the proper chlorine concentration.
All right, thank you, Dr. Kavanaugh, and we had some good questions on the health side. We next want to hear from a couple of our elected officials. One of the big changes with this phase one is you're going to start seeing some of the public agencies open soon, and that's going to be covered with our next couple of speakers. Tony Gilreath, Police Jury President.
Thank you, Brian. Thank you. We're on the right track here in Calcasieu Parish, and I want to say thank you for everyone for their cooperation and patience. And because of you, we're ready to start phase one of opening the parish. I would like to also announce that beginning Monday, May 18th, Calcasieu Parish Police Unit offices will be open to the public. We have been preparing for this many weeks, and we have many safety measures in place so that we have safety to open the Calcasieu Parish offices. We're ready to start phase 1, but we must not let our guards down. Continue to practice social distancing, and we must not and also wear your mask in the public. I want to say thank you, and please continue to be safe as possible. Thank you, Brian.
Thank you, Tony. And we will be having a news release coming out probably before the end of the day regarding the opening of parish offices with more detail. I know from us meeting with mayors and the sheriff and Tony, I encourage the public, we all do, to check with your respective city or agency if you have questions. And I want to remind everybody, all of the public agencies have been open, if you will, all along in terms of services. The difference here is that we will now be able to have the public be able to interact physically at our location. So that's the difference. At this time, we will hear from Lake Charles Mayor Nick Hunter.
Thank you, Brian. Good afternoon, everyone. I just want to confirm that as we do move into phase 1, that decision on a state level and a local level is data driven. It's not driven by emotion. It's not driven by opinion. It's data driven, specifically looking at the different metrics and what constitutes a readiness to go into phase 1. Dr. Kavanaugh just said it, but I want to reiterate that we're in a very stable spot right now here in Southwest Louisiana. That does not diminish the seriousness of COVID-19. It also does not say that those that have suffered or the deaths that have been experienced from COVID-19 are not very serious, and those individuals that have passed from Calcasieu Parish were members of our community. They have brothers and sisters and family members and friends, and their lives matter. So COVID-19 is serious. But again, when we look at where we are right now, especially the data, we are in a spot where we are ready for phase 1. Looking at hospitalization rates, ventilators that are available, those numbers are very stable. And so I just want to encourage the public to know that if we were ever going to go into phase 1, we are at that spot where we are ready for it. We will also be having a full press release this afternoon for the city of Lake Charles. But I want to take the opportunity right now to let everyone know that City Hall, Central School, and some other city buildings will be reopening on Monday, May the 18th. This does not include the Civic Center. We are waiting for some more guidance from the state of Louisiana on our Civic Center. City services such as a recycling drop-off, Mallard Cove, and of course public safety, trash pickup, those things have been going on for some time now. We want to remind everyone that has to visit City Hall for any business that much business can be done online. cityoflakecharles.com is a place where you can pay your water bill or do online permit applications. For anyone that does need to visit City Hall, calling ahead and getting a, excuse me one moment, at the house, calling ahead and getting an appointment or scheduling an appointment with the respective department is always suggested. But if you do have to show up to City Hall, for instance, to pay a water bill, we will be practicing social distancing. There will be markers placed on the floor. We're also installing additional plexiglass to create some barriers between employees that are interacting with the public. The last thing I want to mention is this conversation about how are we as elected officials, government, the public in general, how are we going to get through the next 2 to 3 weeks? And phase 1 is an important moment in time. These next 2 to 3 weeks are very important. The worst thing that we could do is throw caution to the wind and say that phase 1 equates to COVID-19 is not serious anymore and we could get back to business as usual. That would be the worst thing that we could do, because we absolutely could see a spike in cases. We could see a very negative trajectory develop, and we don't want to see that. We don't want to see that because it's not the safe and healthy thing for our citizens, and we also don't want to see it because it's going to interrupt our progress. So when it comes to wearing masks, they are not fun, they are not comfortable, probably not fashionable, but I encourage people to wear masks in public. And it is not a mandate from the state, but it is an encouragement. And on a local level, I can tell you that I'm wearing a mask when I have to venture out into the public. And if it's going to help protect me and help protect my neighbors and my brothers and sisters in this community, I think we should be doing it. And so I encourage that. Also, continuous social distancing as businesses begin to open up. We expect them to adhere to the guidelines set by the state, and we will get through this together. But again, if we simply throw caution to the wind and go back to life as we lived it pre-COVID-19, I am very concerned about what the results of that would be. So if there are any questions, I'll take them at this time.
The playgrounds will still be closed, is that correct?
That is correct. The green space at our parks is open, but we are definitely not encouraging kids or families to make use of the playground equipment, because that just cannot be cleaned in a timely enough fashion between each use. So that's where we are today on that.
I know that citizens are not required to wear masks out in public, but if a business decides that they want to require people who come into their business to wear a mask, that is allowed, right?
So I'm going to toss that to my city attorney, who's not here, but I will tell you that according to our city attorney, a business has the right to service people, and just as people are asked to wear shoes and a shirt to enter a business has the right to ask them to wear a mask. And so that is my understanding that the law allows.
All right, thank you, Mayor. Dealing, of course, with public safety, so let's hear now from our Sheriff, Tony Mancuso.
Sorry, a little technical difficulty unmuting there. I don't want to bore everybody with the same things that your other public officials have been saying, but I think it's important to understand, and I'm talking about the collective public officials that work very closely together, all the mayors, the police bureaus. We come together and collaborate to do what we think is best for the public. In this particular disaster, if that's what you want to call it, I can't thank the doctors enough, Dr. Kavanaugh, Dr. Jordan, many of the other local doctors that have guided us through this. And I again want to stress the importance of what they are still saying. And yes, we're going to open up to Monday morning, as are most of the public agencies in our community. We're still kind of wading through this about exactly how we're going to do this. You know, Stitch and I have an open door policy. We love people, and we enjoy the fact that we let people just show up if they need to come see he or I. But I think we show a poor example if we do that right now. I think it sends a terrible message. So we're going to open, but we're going to ask, again, Mayor, like you said, and the other mayors, I think, that are following suit similarly, that you make an appointment. Many things that we handle do not have to be done face-to-face. And I think until, and again, Dr. Kavanaugh, you can maybe stress this, and I think you have, I think until this is not going to be totally over with, and we're not going to be relieved of the pressure from this until we truly find a vaccine like we do the flu virus. And we don't know if that's going to come in the early fall, in the late fall, or maybe sometime early next year or mid next year. I said all along that we have the best and the brightest here in the United States. People come from all over the world to practice medicine and to learn medicine here. So I'm confident we have the best and the brightest. So I know that they're working hard, but it's just not going to come overnight, and this is not a quick fix problem. And this is not a problem that us as public officials are used to dealing with. And so we are going to rely on our medical professionals, and this is what they are advising us. So we're going to open up Monday, but as far as it's going to be by appointment only, and if you can make the phone call, we're going to encourage that anything that can be done online or through a phone call. We love that personal touch too. We live in Southwest Louisiana where people enjoy that about each other. That we are, you know, I had a man at a store want to shake my hand, and I kind of backed off, which is very unusual for me, and it hurt my feelings, and I'm sure it hurt his feelings, and he understood. But we have to watch that and be careful of that for each other. It's not just if I go around just shaking everybody's hands and then I catch it and I start giving it to people, like you said, Dr. Cavanaugh, without people knowing, then we're just going to regress and go backwards, and that's what we don't want to do. We have worked so hard to get to where we are. I am many times in disasters. Let me tell you something. Our public, we could not ask any more from our public than what we have asked them for this. And they have been patient. They have been tolerant. Our business owners, oh my God, I can't even describe the pain that they have gone through and what they have endured. And we're trying to open this back up, and we want people to visit these establishments, but do it with caution. And remember to keep yourselves clean and wash your hands a lot. Don't stop that just because we're opening up. It's very, very important that we do not fall backwards and continue to move forward with this progress until a solid, legitimate vaccine is prepared and ready that will help, I think, in the long term with this disease. So we've just come too far, and look, crime is still down. I couldn't ask for anything better from a sheriff. Let's continue that. There's no reason why this can't continue for us as a community. Again, I can't ask any more from our public because the crime rate is going down so far. Maybe some little spikes in domestic violence, but even that's not out of control. So I'm just very pleased at the progress we've made, but I am very concerned and cautious about when we open up Monday. If everybody thinks it's just business back to normal and as usual, then I'm afraid that we're going to fall back a little bit, and I don't want that to happen. So let's enjoy this freedom that we're getting, but let's use it cautiously and wisely as we move forward from this point on. So I think that's it, Brian, unless again, Teresa has any questions for me. We still have no outbreaks in the correctional center. We're not going to allow face-to-face visitation quite yet. We're kind of going with the state and the Department of Corrections. We're going to kind of move along with that because keep in mind, we can't self-isolate the general population at the jail. So we're different. We only have so many isolation cells that we can use, and we have quarantined that off in the event we have to use that, and we have not had to yet. So I think it's in the best interest of the inmate population that we have now to continue doing that until we feel it's safe from this point on. So that part's not going to change yet. Again, we're going to phase that in as we think we can. And again, that's going to be when the Department of Corrections and our doctors feel like that population won't suffer and have a mass outbreak. Because if you have an outbreak, it has no way of really stopping in that environment. So far, and look, I'd love to take credit for that, but the men and women in our correctional facility, the medical staff in our correctional facility have done amazing. Knock on wood, I don't even know how that's been possible, but they have done that. So we want to make sure we ensure that and keep them safe in our inmate population. So that will not change as of yet.
Thank you, Sheriff. We appreciate all your work on this. COVID-19, of course, in addition to health impacts, you've got economic impacts, you've got social and community impacts, and emotional and mental impact. But we're going to ask Denise Durrell, United Way Executive Director, to come up they are going to be looking for more specificity on that from the public. We're encouraging the public in great numbers to participate in a new survey that she's going to describe, and we're happy to have her here. Again, Denise Durrell.
Thank you, Brian. First, I'd like to thank everyone who helped us this week with our third food distribution event. We actually were able to help 2,900 people in a few hours and gave out 100,000 pounds of food. We are planning our next event. It will be held in June. We do know that we're going to have to change the location because Preon Lake Mall should be up and running hopefully by then, at least to more capacity than they are now. But in the meantime, if you are food insecure or you have other financial needs or you know someone who does, our 211 call operators are still standing by to take your calls 24/7, 365. We have, since COVID started, already answered 68,000 phone calls across the state. So those operators are there for you. As Brian mentioned, United Way of Southwest Louisiana is collaborating with all of the United Ways across the state so that we can have a better idea of the impact that COVID-19 is having on every one of us across our state. And so we are conducting a COVID-19 impact survey. It truly only takes about 10 minutes of your time, super easy, and the only way that it will identify you is the only thing you have to give personally is your parish and your zip code. There's no information related to who you are. It's completely confidential, but what we're hoping to do is gather the information so that it can help direct us and direct our services and our programs so that we can be of more service to the people, all the people of Southwest Louisiana, as well as those in Louisiana. Very simply, you can go to our website at unitedway.swla.org/survey, and it will take you to that state landing page and take you directly into the survey. And the survey is open today as we speak and will close on Friday, May the 22nd. So you've got a 9-day window, but again, it will only take 10 minutes. And I encourage every one of you out there and everyone in our community, please, whether you've been impacted or not, please take part in the survey so that we'll just have a better idea of how it's really affecting us in our community. So thank you very much.
All right, and we encourage everyone to participate. Again, what was the ending date? May 22nd?
May 22nd.
Thank you. As we go to the question and answer period, just a reminder, the governor's time start on phase 1 is tomorrow, Friday, May 15th, and it ends June 5th. Of course, whatever happens after that, I'm sure he will announce a few days in advance, but that is the official phase 1, if you will. At this time, if there are any further questions, we will take that. Because we are at the end of our speakers for today.
Quite a few people in the public are asking where they can get face masks for themselves. Any suggestion?
I understand, and I could use some help maybe from Dick, that you can find them at certain retail locations or order online. We have been very successful in getting these out to businesses that we got in earlier at the parish, but that has been completed. Other than that, I don't. Dick, do you have a? So a lot of your regular, what you would call essential retailers that are open are now selling them, and that is what we encourage folks to do. And if you just need to contact the parish for any specifics, we can do that. But they are available at private stores in the community. That's it. Okay. We are going to wrap this up. Our next briefing is not going to be next week. We're going to actually give it 2 weeks. We are in a different phase now. Certainly, if something comes up prior to that, we can call a public briefing. But for now, the next scheduled media briefing will be on Thursday, May 28th at 2 p.m. Thank you.